A husband and wife went to see their friend's newborn baby in the hospital. On their way back, they observed babies in the newborn ward through the window. They were startled to see a baby who was in yellow and had been placed in an incubation box with phototherapy lights. They were curious what disease the baby is having, and a nurse happened to be walking by, so the wife decided to ask her.
Excuse me, may I know what happened to this baby?
Oh, the baby was unfortunately suffering from an inborn error metabolism disease called G6PD deficiency. This glucose-6-phosphate dehydrogenase enzyme is essential for assuring red blood cell normal lifespan. It is an X-linked disorder that may be inherited from mother, usually a healthy carrier or affected father to son or daughter. It is a lifelong condition. However, G6PD deficient patients can have a completely normal life as long as they avoid triggers such as foods, drugs, and chemical exposures that can cause oxidant stress. And this is a phototherapy treatment which is used to reduce the level of bilirubin in the blood, as it is common for babies to have jaundice, which is yellowing of the skin and eyes in their first week of life. Some symptoms may also notice such as shortness of breath and change in stool or urine color in dark yellow-orange. People affected with the disease might develop hemolytic anemia, as red blood cells depend solely on G6PD activity to prevent against dangerous oxidative metabolites.
How is the baby diagnosed with this disease?
There are several tests available nowadays. You can determine whether you are G6PD deficient by a simple blood test. It is to test G6PD level in your blood. There are other tests such as complete blood cell count and reticulocyte count, as well as peripheral blood smear.
As he mentioned, it is an X-linked disorder. So how do we prevent our baby from getting this disease in the future?
Actually, if two of your family members do not have this disease, there is lower risk for your baby to develop. Since in Malaysia, the overall prevalence of G6PD deficiency with general population is 3.4%. There is a neonatal screening for G6PD deficiency for newborn babies once they are born, which they will test with their umbilical cord blood. But if patients expect they are carriers of G6PD gene, they may also want to screen for genetic testing before deciding to have a baby.
Is there any treatment for this baby?
Although there is no treatment available to reverse it, underlying infections are treated accordingly. A more aggressive treatment may be required for individuals who have progressed to hemolytic anemia. This sometimes includes oxygen therapy and a blood transfusion to replenish oxygen and red blood cell levels. However, prevention is better than cure. Managing G6PD deficiency involves avoiding foods such as fava beans, which has been proven to cause hemolysis. Chemicals such as henna dyes used for tattoo and hair. Reducing stress level can also help in controlling the symptoms of G6PD deficiency.
Oh, thank you so much for giving us these informations.